So what we see here is two crowns, one full metal, the other one will be partially metal, and in between we'll do two pontics. So first we isolate the crest. Isolation or insulation, that's the same word. Many people say insulation. So this is a wax that has a certain thickness. It's 0.4 thickness wax. We try to create this shape that will look like a case. So that is going to be the metal, as you can understand. All that is wax now will be turned into metal by casting, and then the space remaining will be filled with polymer, with plastic, right? To have it aesthetic and cheap in the same time. Way cheaper than ceramics. Not as nice, but that's it. You can't have everything. So this is the shape of what will be the metal component of the pontics. See, the wax is used as a welding material. Yellow wax regular is a wax that has very low contraction upon setting. The technician is cutting the excess here just to be able to create the welding in the very right place. That's the junction between the pontic and the crown. Again, that on the molar is a full metal crown. The one on the canine is a partially metal crown. On the labial, it has retentions, mechanical retentions for polymer, for plastic, right, for resin. Now, this side will be, as you see, turned over in order to be used as the part for the occlusal side of the tooth, of the teeth, of the two pontics actually. So the technician tries to create the needed space in occlusion for the two pontics now. It doesn't look like that. I mean, it's kind of weird when you look at that. But yeah, that's the way that things are done, or were done, to be more precise, because this is a very rare occurrence today. So yes, place it back. You see the contact with the crest? It's kind of a tangent there. And now the technician tries to unite the upper and the lower part on the inside. Again, making sure that there will be enough space for the for the wax to be placed where we will have to have an occlusal contact. I always tend to say metal, although this is wax, because obviously being a pattern, it will be turned into metal. See here, it's the separation between the two teeth. Again, it looks weird, I know. This is the interdental part, that's the second premolar in conjunction to the molar, right? So the excess wax is taken away. Of course, the instrument has to be hot enough, not too hot, because we don't want to damage the neighboring crowns, but hot enough to cut this wax away. And yes, now it starts looking familiar, right? It has to be rounded as well. And you see, because we have a resin there, we don't want this resin to touch against the antagonists, the mandible teeth. So what we do this metal, this pontics, we do them with a protection for the you see, it goes over the lower teeth, a protection to protect the plastic that we will place in that hole. So now the technician is kind of adapting everything in occlusion. And cutting all those margins just to make sure that they are not too long. Looking on the interior to see if everything is okay. So there's enough space. And now this is some sort of a reinforcement that will prevent that thin part, occlusal part, to bend, and in the same time it will act as a retention for the plastic material, the composite resin or the simple resin that will be placed to fill the space there and to create the better looking appearance of those two pontics. And now, yes, everything has to be covered, closed, to make them look like teeth on the palatal side. Separation in between the teeth. That's the separation I was speaking about. The tongue of the patient should feel that there's kind of teeth there and not some bulky whatever material, right? So the technician knows exactly how hot it has to be. Now you see that it has already been modeled. It has been, the movie has been cut here. So this is the occlusal surface of the pattern, and you see that now we arrange the margin. Right? This is very important to respect the morphology, to have the right morphology. The palatal cusp, you see, the palatal cusp of the first premolar is smaller than the labial one, right? The the second premolar has equal cusps, relatively equal cusps. So yes, this yellow and green wax was added, as you can see, to make the occlusal part correct, anatomically correct, right? And this is very important here to cut nicely and to make it look like a tooth, yeah, to have the gum look like a gum, mimic the papilla, the interdental papilla. So slowly we try to cut this down. But as you can see, we want to allow the metal to sit on the gum and not the polymer. That's another story that, well, the classic way is to have only metal in contact with the gum. That's another discussion that goes on up to this day. Ceramic is better, zirconia is the best. The composite, well, people still speak about it. Acrylic, no way. And metal, well, that can be a solution, as you see here. You see the distance here allows the patient to clean. The space is a space for cleaning. And, yes, now we try to make the papillas look better. Obviously, over all this, so all this will be turned into metal, and then over all this, we will place some aesthetic material, that's resin, simple resin or composite resin. Mainly this is done for simple resin. As I said, it's kind of old school restoration. So the papilla should be respected. There we should have some space for cleaning. Yeah, the interdental brush should be able to pass through. You see a little bit of light on the two margins, right? Next to the crowns. And that light that shines through tells us that there is a space where the interdental brush can pass through. This is very important to allow the patient to respect the hygiene. And yes, this is to be done according to what the antagonists are looking like and the shape of the dimension of the antagonists. There should be no premature contact there. It has to be very precise. Of course, being a metal, you can always trim a little bit from it, but the ideal is to create the pattern right from the start. So you see, that's why the technician is measuring and tries to see whether this fits or not. And the occlusal contacts, to make sure that the occlusal contacts are right. And she's adding a little bit if necessary, where necessary. Yes, we could use some sort of white wax and then use some articulation paper, maybe red articulation paper, blue, to see exactly where we have contacts. But the technician prefers to put some wax and add some wax, and then while the wax is still hot, well, not hot, but warm, to compress that wax with the antagonists. And then she hopes to get a better adaptation at the level of this contact with the antagonists. Again, this is a yellow wax, which is very easy to model. It's not brittle at all, kind of soft, with very low contraction after, while solidifying. So that's the space. You see that there is not a full contact there. We don't want full contacts between teeth. We want just the right contacts, occlusal contacts, point-like occlusal contacts. And now the technician is doing more fine-tuning, so to say. Yes, you can do that when the piece becomes metal. After you cast it, you can, yes, but it's way easier now, obviously. And the best thing is not to touch the metal after you cast it, just to polish it. if possible. That would be the best, right? So to have this, you could even polish the wax before investing the pattern, in order to get, after the devesting, to get a very, very nice looking metal already. And then with a little bit of polish, you're done. The more you put your burrs on the metal, the more that metal will become porous, and it will be non-hygienic. The less you touch a metal after casting, the better it is. And those are the marginal crests that she's starting to design now, as you can see. It's very important to have a good contact with neighboring crowns, because otherwise masticatory forces could break the whole structure there at the intermediate, at the junction between the pontics and the crowns. So she's checking again that everything is okay in occlusion. So the contact with the antagonists should be, as we said, in points, point-like contact, not surface-like contact. This is very important, because if you have point contact, then you have a lot of pressure, right, at a lower force. If you have a surface contact, then in order to get the same pressure, you need much bigger force. Newton per square meter, that's the idea of pressure, right? So now, as you can see, the thing is modeled very, very nicely and carefully. Of course, is that if the technician knows how to do that, that's another story. You see the labial cusps, that is actually the protection, the metal protection. And we move it a little bit to the lateral to make sure that there is no contact. But of course, this is better done in an articulator. This is just a demonstration. Normally you have an articulator. And now, as you can see, we do some more retentions. There is a special bar, wax bar, 1 millimeter bars. And you use this to create even more retention for the resin, for the acrylic resin that will be placed in those boxes. So this is welded now in place. It's kind of easy when you know what you're doing, but see, the technician knows exactly how hot or warm the wax is and how much it can bend, and that's about knowing your material. And it has to be far away enough from the labial side of the tooth. So those are pearls. Here is a bar to create the retention. Of course, because you have a lot of space on the pontics, right? But it has to be, as we said, far enough from the final labial surface of the teeth, of the pontics, so that the acrylic resin will be able to cover the metal, that the metal will not shine through. Of course, we will apply some opaquer on the metal, but nevertheless, if you have more space there, it's better, right? So that's the second one, the second mechanical retention, which is as well as a reinforcement. It acts as a reinforcement, no doubt. Yeah, here you see it's like a pillar to reinforce the whole structure. So that's what it looks like, and this is really cheap because you just cast it in metal, and then you put some acrylic resin, which is really, really cheap, and you're done. It looks like teeth, right? At least from afar a little bit. So this is the pattern.